is Sarah, and this is my assistant Barbie. She's going to be helping me do an abdominal assessment today to show you guys what you need to look for when doing your abdominal assessment. So first off, we're going to ask Barbie to lie down so we can get a better look of her abdomen. We want to make sure that we maintain Barbie's privacy by keeping her covered at all times. So we're just going to use this towel. Okay, so first off, we're going to go ahead and inspect Barbie's abdomen. We want to make sure that we're looking for the color, the shape, this symmetrical aspect of the abdomen, the contour, if there's any lesions, any masses, discoloration, scars. We also want to look and see if there's any visible distension or ascites that might be present on our assessment. We also want to look and see if there's any pulsations, which is an abnormal finding. And that's about it. So now we're going to move to our next step, which is going to be auscultate. We're going to listen next before we palpate or percuss, because we want to make sure that we get accurate bowel sounds and that we don't interrupt anything when we do the palpation or percussion. So we're going to take our stethoscope and we're going to go ahead and listen. I'm going to pretend like I'm listening so I can hear what I'm saying. So for bowel sounds, we're going to use our diaphragm of our stethoscope, and we want to listen to all 4 quadrants, starting with the right lower, moving to the right upper, to the left upper, and then to the left lower quadrant. We want to listen for any gargling or clicking sounds, which would indicate peristalsis or movement in the GI tract, which is good. There's supposed to be 5 to 30 gargling or clicking noises every minute. If you don't hear anything, then you want to make sure that you listen for a complete 5 minutes before you say that there are no bowel sounds. So we're going to go ahead and take a listen. Starting from the right lower, right upper, left upper, and left lower. Good. So now we're going to go ahead and turn our stethoscope around and use the bell of our stethoscope to listen for any bruits or vascular hums. For bruits, you want to listen in the aortic artery and also the iliac arteries, which would be, it makes a swishing noise. And that would be an abnormal finding, which could indicate obstruction or obstruction of the artery. So then you also want to make sure that you listen for any vascular hums. Which is actually a normal finding in pregnant women and children. So you want to listen in the epigastric region, and that would be for a low-pitched sound, which could also indicate maybe obstruction or decreased blood flow to an organ, but it is a normal finding in children and pregnant women. So after we auscultate, we're then going to move to percussion of the abdomen. And we're just going to take our hand, and this is to test for any tenderness, pain, to see if there's any air or fluid in the abdominal area. You want to look for any signs of pain while you're doing this and intervene if there are any signs of pain. Next, we're going to move to palpate, and that's the last step. So we're going to first lightly palpate Barbie's abdomen with our fingertips, hands down, fingertips, and we want to push 1 to 2 centimeters in each quadrant. You're also looking for any pain. You want to feel for distension of the abdomen, the bladder, anything of that sort. Then with deep palpation, it's going to be 4 to 6 centimeters. And we're going to assess for any enlarged organs, any masses, pain, distension. Reasons you would not want to palpate would be for a patient with a transplanted organ. Usually when they do the transplants, they put the organs in a anterior spot, which is less protected than the original spot of the organ. In children, another thing that you would not want to, a time when you would not want to palpate would be if there is a suspected Wilms tumor for the patient, because when palpating, you might initiate seeding of the tumor into other organs. You do not want to do that. So we're going to help Barbie sit up. Barbie, you did great today. Everything looks good with your abdomen. Do you want to pick a toy out of the toy chest? Okay, well, we're all set here. Thank you so much, Barbie. Thank you guys for watching, and I hope that you learned something from my abdominal assessment.